Hello everyone, this is Dr. Sushma Sarila, consulting homeopath at Fidicus Women. Now let us look into the structure and function of the female reproductive organ as such. So by knowing the structure and function of this female reproductive organ, we will be knowing where the problem is occurring, how the problem is occurring, and why it is occurring, and what is the prognosis of the problem. So let's look into it. This is the female reproductive organ. As you can see, this is it. So here these are the ovaries which produce ovum, and from this the ovum is released, and it is collected by the fallopian tube. As you can see here, there are two tube-like projections. These are called as fallopian tubes. Okay, and the ovary will have an ovum release, and the ovum or the egg will come and travel here, and it will stay here. Okay, and after an intercourse, the sperm will enter and it has to go here, and when it meets the ovum, there is fertilization and zygote formation. This is a normal phenomenon, and the female body is preparing herself for pregnancy every month. Usually on the 14th day the ovum will be released, and also apart from that, if there is no intercourse, or if there is no fertilization, the ovum, which is supposed to become zygote after in contact with the sperm, will not become a zygote. It will travel down, and along with it the endometrial tissue, which is preparing in thickness, which is becoming thick so as to hold the baby, will also come down. That is nothing but menstruation. Okay, so this is the normal thing happening in the uterus. Apart from that, you have to understand that uterus has three linings, which is the outer lining, the middle lining, and the inner lining. The inner lining is called the endometrium, the middle lining is called the myometrium, the outer lining is called the perimetrium. Okay, and depending upon the layers of the uterus, the fibroids are located. And also uterus is very susceptible to the female hormones, which is estrogen and progesterone. The endometrial thickness, so as to hold the baby, that thickness, whatever is it's growing in size, is because of the female hormone. So if there is any fluctuation in the female hormones, it can lead into fibroids or any other female reproductive organs. If you're someone who is suffering from female reproductive organ diseases and you want to know about hormones in detail, we have already done a video on that, which is called as hormones and fibroids. We will be giving you the description in the link below this video. You can check it out also. So here you have known the structure, and here you have known the function of the uterus as well, that is to carry a baby. Whenever there is no baby, there will be menstruation. If you're someone who is experiencing fibroids and watching a video, if you want to have a good cure for your symptoms as such, you should be choosing Fidicus Homeopathy. In Fidicus Homeopathy, we have two kinds of consultation options. One is the online consultation if you're staying far away from the nearest branch of Fidicus, and in-person consultation if you're staying near the nearest branch of Fidicus. In online consultation, we have two options. One is the audio consultation, and the second one is the video consultation. You can approach us through either one of it. And also, after the consultation has been done, and if you're having any sort of investigations already done, you can share it with us. After the case taking and the doctor consultation, the medicines will be delivered to you, especially to the online clients. Home delivery will be done. If you're staying in India, it will take 3 to 4 business days for our medicines to reach your doorstep. If you're staying in USA, it can take 3 to 5 business days. Across the globe, it can take 4 to 8 business days. If you want to contact us, you can contact us to the given number here, either through WhatsApp, either through call, or either through message. Okay. And if you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you are experiencing any sort of fibroid issues, infertility, or female reproductive diseases like endometriosis, adenomyosis, chocolate cyst, or hemorrhagic cyst, PCOD, PCOS, dysmenorrhea, which is painful periods, if you're looking for cure, Fidicus Homeopathy is the answer. Why is it that you should choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. First, the reason for doing this video is itself because of the high and good amount of success rates that we are having in this female reproductive organ diseases. Second is the transparent treatment, where there is no gray area between the patient and the doctor. We will be discussing you in detail about your prognosis. And the third thing is the personal care. The personal care here at Fidicus is really top notch. The reason reason for this video is because of the personal care. That is because in persons or the online clients have asked us so much of questions that we wanted to do a video in order to convey it and also in order to educate other people. So the personal care, we will be discussing in detail all of your myths, we will be busting it, and we will be educating you. So if you want to choose cure, if you want to have an answer for all of your diseases, Fidicus Homeopathy is the answer. So choose Fidicus Homeopathy if you want to choose cure. Thank you.